Have you ever wondered why you take omega-3 supplements every day, yet your memory decline or joint pain hasn't shown much improvement? For those aged 50 and over, omega-3 is truly the golden key to health. But the truth is that our body's ability to absorb fats gradually declines with age. If you don't know how to use it correctly, you aren't just wasting money. You are also unintentionally putting pressure on your digestive system. Today's video will help you identify the 7 most common mistakes and how to fix them to optimize brain health and scientifically manage inflammation. The first mistake many people make is choosing the wrong ratio of EPA to DHA. You need to understand that EPA and DHA play 2 entirely different roles. EPA helps fight inflammation and protects cardiovascular health, while DHA is a primary structural component of the brain and eyes. The biggest mistake is buying cheap fish oils, where the EPA and DHA content is too low compared to the total amount of oil in one capsule. My advice for those over 50 is, if you want to improve memory and prevent dementia, prioritize products with high DHA content. Conversely, if you are dealing with chronic arthritis or cardiovascular issues, choose a formula where EPA is dominant. The second mistake is taking omega-3 on an empty stomach or during a meal that contains no fat. Scientifically, omega-3 is a fat-soluble fatty acid. To be absorbed, the body requires digestive enzymes and bile, which are only secreted when we consume fat. Taking it on an empty stomach can reduce absorption by 50% to 80% and often causes unpleasant fishy burps. The simplest fix is to take it during or immediately after your largest meal of the day, especially one containing healthy fats like eggs, avocado, or vegetable oils. The thirdly mistake, a lesser-known mistake, is failing to distinguish between the triglyceride and ethyl ester forms. On the market, the ethyl ester form is more common and cheaper, but it is harder to absorb and less stable. Meanwhile, the triglyceride form is the natural form found in fresh fish and has an absorption rate up to 70% higher than the other. When buying, check the label carefully for the words triglyceride form. This is a vital factor for the sensitive digestive systems of seniors. The fourth mistake, which is extremely dangerous, is using oxidized products, otherwise known as rancid fish oil. Oxidized fish oil not only loses its benefits, but also creates free radicals that cause more inflammation in the body. You can identify this by signs such as capsules having a strong, pungent, fishy smell, a bitter taste, or a cloudy color. For best preservation, avoid direct sunlight, store it in a cool place or the refrigerator, and prioritize products that include vitamin E as a natural antioxidant. The fifth mistake is forgetting to check for interactions with underlying medications. An important warning for those over 50. High-dose omega-3 has a natural blood-thinning effect. If you are taking anticoagulants like warfarin, aspirin, or certain blood pressure medications, uncontrolled omega-3 supplementation can lead to a risk of bleeding. Therefore, always consult your doctor regarding the appropriate dosage to ensure absolute safety. The sixth mistake many people make is believing that omega-3 from plant sources like chia seeds or flax seeds is enough. These seeds contain ALA, but the elderly body converts ALA into EPA and DHA very poorly, only about 1% to 5%. Therefore, you should not skip fish oil or krill oil, as these are direct sources of the fatty acids your body needs immediately to protect the brain and heart. Finally, the seventh mistake: ignoring purity standards and heavy metal sources. Large fish like sharks or swordfish often accumulate high levels of mercury and lead. These heavy metals are extremely toxic to the nervous systems of older adults, counteracting the benefits of brain protection. The safest choice is to look for products extracted from small fish, like sardines and anchovies, or products with a 5-star IFOS, International Fish Oil Standards, certification for international purity. To optimize your omega-3 use, I suggest the following 3-step roadmap. Step 1. Recheck your supplement label for the actual EPA/DHA content and its molecular form. Step 3. Listen to your body. After 4 to 8 weeks of proper use, check if conditions like dry eyes, joint pain, or mental clarity have improved. Remember, using omega-3 correctly is the cheapest and most effective investment for your brain and joints in your golden years. Don't just take it out of habit, take it for scientific results. If you found this information helpful, please subscribe to the channel so you don't miss out on in-depth health secrets tailored just for you. I wish you continued health and mental clarity.